Question 1. A nurse is caring for a client with chronic obstructive pulmonary disease, COPD, experiencing acute dyspnea. Which of the following positions should the nurse encourage to best facilitate breathing? A. Supine with the head of the bed flat. B. Prone with the head of the bed elevated. C. High Fowler's position with arms supported on an overbed table. D. Trendelenburg position. Answer: C. High Fowler's position with arms supported on an overbed table. This question tests knowledge of therapeutic positioning for clients with respiratory distress, a key concept in medical surgical nursing. The phrase "best facilitate breathing" is a clue indicating the most effective intervention. High Fowler's position, especially with the client leaning forward and supporting their arms, allows maximum chest expansion and reduces the work of breathing for clients with COPD by utilizing accessory muscles more effectively. For example, helping a client sit upright in bed with pillows under their arms on an overbed table can significantly ease their dyspnea. Remember that proper positioning is a simple yet powerful nursing intervention to improve oxygenation and comfort. Question 2. A client is prescribed a new bronchodilator for asthma management. The nurse should instruct the client to use this medication for which primary purpose? A. To reduce inflammation in the airways. B. To prevent respiratory infections. C. To open constricted airways quickly. D. To thin respiratory secretions. Answer: C. To open constricted airways quickly. This question assesses understanding of bronchodilator medication function, a fundamental concept in respiratory pharmacology. The phrase "primary purpose" highlights the main action of this drug class. Bronchodilators work by relaxing the smooth muscles surrounding the airways, thereby widening them and improving airflow, which is critical during an acute asthma attack or for managing bronchoconstriction. For instance, a client using an albuterol inhaler during an asthma flare-up will experience rapid relief as the airways open up. Always remember that bronchodilators are primarily for quick relief of narrowed airways, not for long-term inflammation control or infection prevention. Question 3. A nurse is assessing a client with pneumonia. Which adventitious lung sound would the nurse most likely auscultate? A. Wheezes. B. Rhonchi. C. Crackles. D. Pleural friction rub. Answer: C. Crackles. This question focuses on lung sound assessment in the context of a specific respiratory condition, pneumonia, a vital skill in medical surgical nursing. The key is to connect the pathological process of pneumonia to the expected lung sounds. Pneumonia involves inflammation and fluid accumulation in the alveoli, which typically produces crackles, often described as a popping or crackling sound, when air moves through the fluid-filled spaces. For example, when listening to a client with pneumonia, you might hear fine crackles during inspiration as the collapsed alveoli pop open. Always associate crackles with fluid in the smaller airways or alveoli, often seen in conditions like pneumonia or heart failure. Question 4. The nurse is caring for a client with a chest tube inserted for a pneumothorax. Which finding in the chest drainage system requires immediate notification of the healthcare provider? A. Intermittent bubbling in the water seal chamber with respirations. B. 50 milliliters of serosanguineous drainage in the collection chamber over 8 hours. C. Continuous bubbling in the water seal chamber. D. Fluctuation, tidling, in the water seal chamber with respirations. Answer: C. Continuous bubbling in the water seal chamber. This question tests critical assessment skills related to chest tube management, a high-acuity concept in medical surgical nursing. The keyword "immediate notification" points to a potentially serious complication. Continuous bubbling in the water seal chamber, aside from initial air removal after insertion, indicates a persistent air leak in the system or from the client's lung, which needs prompt investigation and intervention. For example, if you see constant bubbling in the water seal and the client's respiratory status is worsening, it's a red flag. Remember that intermittent bubbling and tidling are expected findings. Continuous bubbling often signals a problem. Question 5. A client with a new tracheostomy tube requires suctioning. Which of the following actions should the nurse perform first? A. Hyperoxygenate the client with 100% oxygen. B. Insert the suction catheter until resistance is met. C. Apply suction for 10 to 15 seconds. D. Assess the client's breath sounds and oxygen saturation. Answer: D. Assess the client's breath sounds and oxygen saturation. This question assesses the nurse's understanding of tracheostomy care and the critical initial steps of suctioning, an essential skill for preventing complications. The word first indicates the priority action in a sequence. Before performing any invasive procedure like suctioning, it is crucial to assess the client's current respiratory status, including breath sounds and oxygen saturation, to determine the need for suctioning and establish a baseline. For instance, if a client has clear breath sounds and good oxygen saturation, suctioning might not be immediately necessary. Always assess before you intervene, especially with respiratory procedures. Question 6. A nurse is reinforcing education for a client newly diagnosed with tuberculosis, TB. Which statement by the client indicates a need for further teaching? A. I will need to take these medications for several months. B. I should wear a mask when I am in public places. C. I am contagious only when I am coughing. D. My family members may need to be tested for TB. Answer: C. I am contagious only when I am coughing. This question tests the client's understanding of tuberculosis transmission and contagiousness, a crucial public health concept in medical surgical nursing. The phrase "need for further teaching" points to an incorrect understanding by the client. While coughing increases the risk of spreading TB, a client with active TB can still be contagious even without coughing, as the bacteria are spread through airborne particles from talking, singing, or sneezing. For example, advising a client with active TB that they remain contagious as long as they are shedding bacteria, regardless of obvious symptoms, helps reinforce the importance of adherence to treatment and precautions. It's important to emphasize that contagiousness persists until the client is deemed non-infectious by healthcare providers, usually after a period of effective medication therapy. Question 7. A client is admitted with acute respiratory distress syndrome, ARDS. The nurse anticipates that the client will likely require which intervention? A. Low-flow nasal cannula oxygen therapy. B. Incentive spirometry every hour. C. Mechanical ventilation with positive end expiratory pressure, PEEP. D. Bronchodilator inhalers as needed. Answer: C. Mechanical ventilation with positive end expiratory pressure, PEEP. This question evaluates the nurse's understanding of severe respiratory conditions and their typical management, specifically ARDS, a complex concept in critical care medical surgical nursing. ARDS is characterized by severe hypoxemia refractory to oxygen therapy, meaning the lungs are too stiff and damaged to adequately exchange gases on their own. Therefore, mechanical ventilation, often with PEEP to keep alveoli open, is typically required to support oxygenation and ventilation. For instance, a client in severe ARDS will have profound difficulty breathing and very low oxygen levels, necessitating invasive respiratory support. Remember that ARDS is a severe lung injury requiring aggressive respiratory support, not just simple oxygen or breathing exercises. Question 8. The nurse is preparing to administer oxygen to a client with COPD who has chronic hypercarbia. Which oxygen delivery method and flow rate would be most appropriate? A. high-flow nasal cannula at 10 liters per minute. B. Non-rebreather mask at 15 liters per minute. C. Venturi mask at 28% oxygen. D. Simple face mask at 8 liters per minute. Answer: C. Venturi mask at 28% oxygen. This question addresses safe oxygen administration for clients with COPD and chronic hypercarbia, a critical concept in respiratory care. The key is understanding that clients with chronic hypercarbia, high CO2 levels, rely on hypoxemia, low O2 levels, as their primary respiratory drive, and too much oxygen can suppress this drive. A Venturi mask provides precise, low-concentration oxygen, which is crucial for these clients to prevent respiratory depression. For example, using a Venturi mask set to deliver 28% oxygen ensures the client receives enough oxygen without excessively increasing their blood oxygen levels and risking hypoventilation. Always choose a precise, low-concentration oxygen delivery method for clients with chronic hypercarbia. Question 9. A client reports sudden onset of sharp, pleuritic chest pain and dyspnea after a fall. On assessment, the nurse notes absent breath sounds on the affected side and tracheal deviation. These findings are most indicative of A. Acute bronchitis. B. Pleural effusion. C. Tension pneumothorax. D. Asthma exacerbation. Answer: C. Tension pneumothorax. This question tests the nurse's ability to recognize the signs and symptoms of a life-threatening respiratory emergency, a crucial skill in medical surgical nursing. The combination of sudden onset of sharp, pleuritic chest pain, dyspnea, absent breath sounds on the affected side, and especially tracheal deviation strongly points to a tension pneumothorax. This condition involves air trapped in the pleural space, compressing the lung and shifting mediastinal structures, which is a medical emergency requiring immediate intervention. For example, if you assess a client with these signs, your immediate action would be to prepare for a needle decompression or chest tube insertion. Always be alert for the cardinal signs of a tension pneumothorax, as it can rapidly lead to cardiovascular collapse. Question 10. A client with asthma is prescribed a daily inhaled corticosteroid. The nurse should emphasize which instruction regarding this medication? A. Use it only when experiencing acute wheezing. B. Rinse the mouth thoroughly after each use. C. It should cause immediate bronchodilation. D. It will cure the asthma permanently. Answer: B. Rinse the mouth thoroughly after each use. This question focuses on client education for inhaled corticosteroids, a common medication in respiratory management. The key is to understand the potential side effects and how to mitigate them. Inhaled corticosteroids can cause oral candidiasis, thrush, or hoarseness. Rinsing the mouth after use helps prevent these local side effects by removing medication residue. For example, after taking their morning inhaled steroid, a client should immediately rinse their mouth with water to reduce the risk of developing a white coating in their mouth. Always teach clients to rinse their mouth after using inhaled corticosteroids to minimize local side effects. Question 11. A nurse is providing discharge teaching to a client with newly diagnosed sleep apnea. Which instruction is most important for preventing complications? A. Avoid daytime naps. B. Limit caffeine intake. C. Use the continuous positive airway pressure (CPAP) machine as prescribed. D. Perform daily breathing exercises. Answer: C. Use the continuous positive airway pressure (CPAP) machine as prescribed. This question assesses the nurse's understanding of the most effective management strategy for sleep apnea and its impact on client outcomes. The phrase, "most important for preventing complications," guides you to the core intervention. CPAP therapy is the primary and most effective treatment for obstructive sleep apnea as it provides a continuous stream of air that keeps the airway open, preventing apneic episodes and associated risks like cardiovascular complications and excessive daytime sleepiness. For example, consistent use of CPAP can significantly improve a client's sleep quality and reduce their risk of heart problems. Emphasize that consistent CPAP use is vital for managing sleep apnea effectively and preventing long-term health issues. Question 12. A client is receiving oxygen therapy via nasal cannula at 2 liters per minute. The nurse notes the client's oxygen saturation is 90% and the client is restless and confused. What is the nurse's priority action? A. Increase the oxygen flow rate to 4 liters per minute. B. Reassess oxygen saturation in 30 minutes. C. Notify the healthcare provider immediately. D. Encourage the client to deep breathe and cough. Answer: A. Increase the oxygen flow rate to 4 liters per minute. This question tests the nurse's ability to recognize and respond to signs of worsening hypoxemia, a critical immediate intervention in medical surgical nursing. The clues are restless and confused, which are early signs of cerebral hypoxia, and an SpO2 of 90%, indicating inadequate oxygenation. Increasing the oxygen flow rate is the immediate and most appropriate nursing action to improve oxygen delivery quickly, assuming the client is not at risk for oxygen-induced hypercarbia. For example, if a client on low-flow oxygen shows signs of inadequate oxygenation, the nurse should first try to improve oxygen delivery before escalating to provider notification, unless immediate life-threatening signs are present. Always prioritize improving oxygenation immediately when a client shows signs of hypoxemia, then reassess. Question 13. A client with a new diagnosis of emphysema asks the nurse, "How will this affect my breathing?" The nurse should explain that emphysema primarily causes A. Thickening of the bronchial walls, leading to increased mucus production. B. Destruction of the alveolar walls, leading to air trapping. C. Spasms of the bronchioles, causing acute shortness of breath. D. Accumulation of fluid in the pleural space, impairing lung expansion. Answer: B. Destruction of the alveolar walls, leading to air trapping. This question assesses the nurse's understanding of the pathophysiology of emphysema, a core concept in explaining COPD to clients. The key is relating the specific lung damage to the client's symptoms. Emphysema is characterized by the destruction of the delicate alveolar walls, which leads to larger, less elastic air spaces and a loss of elastic recoil, making it difficult to exhale air effectively, resulting in air trapping. For example, a client with emphysema often struggles more with exhaling than inhaling because their damaged lung tissue cannot push air out efficiently. Understanding the specific pathology of emphysema helps nurses provide targeted education and care. Question 14. When educating a client about pursed lip breathing, the nurse should explain that its main purpose is to A. Strengthen the diaphragm. B. Decrease the work of inspiration. C. Promote exhalation of trapped air. D. Increase respiratory rate. Answer: C. Promote exhalation of trapped air. This question tests knowledge of therapeutic breathing techniques, specifically pursed lip breathing, which is commonly taught in respiratory conditions. The keyword main purpose directs the learner to the primary benefit. Pursed lip breathing helps clients with obstructive lung diseases like COPD to slow down exhalation, keep airways open longer, and effectively remove trapped air from the lungs, thereby reducing dyspnea. For example, by breathing in slowly through the nose and then slowly exhaling through pursed lips, a client can control their breathing and reduce feelings of breathlessness. Encourage clients to use pursed lip breathing to gain control over their breathing and manage air trapping. Question 15. The nurse is assessing a client with suspected pleural effusion. Which percussion sound would the nurse anticipate over the affected lung area? A. Resonant. B. Hyperresonant. C. Dull. D. Tympanic. Answer C. Dull. This question evaluates the nurse's physical assessment skills, specifically percussion findings related to pleural effusion, a common respiratory condition. The presence of fluid in the pleural space, as in a pleural effusion, will produce a dull or flat percussion sound over the affected area because the fluid dampens the vibrations. For example, when percussing a client with a significant pleural effusion, the sound will be solid and thud-like, in contrast to the hollow sound over healthy lung tissue. Remember that dullness on percussion suggests fluid or solid tissue underlying the area, differentiating it from the normal resonant lung sound. Question 16. A client presents to the emergency department with an acute asthma exacerbation. Which medication is the nurse most likely to administer first? A. Inhaled fluticasone. B. Oral prednisone. C. Albuterol nebulizer. D. Monteliacast. Answer C. Albuterol nebulizer. This question tests the nurse's knowledge of priority medications for acute respiratory distress, specifically an asthma exacerbation, a crucial emergency care concept. For acute asthma exacerbations, a short-acting beta agonist, SABA, like albuterol is the first-line treatment because it rapidly relaxes the bronchial smooth muscles, leading to immediate bronchodilation and relief of bronchospasm. For example, administering an albuterol nebulizer to a client wheezing and short of breath will help open their airways quickly. Always prioritize rapid-acting bronchodilators for immediate relief during an acute asthma attack. Question 17. A nurse is reviewing arterial blood gas, ABG, results for a client with pneumonia. The results are pH 7.28, PaCO 255 mm of mercury, HCO 324 milliequivalent/L, PaO 260 mm of mercury. This indicates A. Respiratory alkalosis with hypoxemia. B. Metabolic acidosis with hypoxemia. C. Respiratory acidosis with hypoxemia. D. Compensated metabolic alkalosis. Answer C. Respiratory acidosis with hypoxemia. This question assesses the nurse's ability to interpret ABG results, a fundamental skill for evaluating acid-base balance and oxygenation. The pH of 7.28 is acidic, the PaCO 2 of 55 mm of mercury is high, indicating respiratory acidosis, and the HCO 3 of 24 milliequivalent/L is within normal limits, suggesting an uncompensated respiratory acidosis. The PaO 2 of 60 mm of mercury indicates hypoxemia, low oxygen in the blood. For instance, a client with severe pneumonia might struggle to adequately ventilate, leading to CO2 retention and a drop in blood pH, alongside impaired gas exchange causing low oxygen levels. Practice identifying the primary acid-base imbalance and then checking for compensation and oxygenation status. Question 18. A client has thick, tenacious respiratory secretions. Which nursing intervention would be most effective in helping to mobilize these secretions? A. Administering a cough suppressant. B. Increasing oral fluid intake. C. Maintaining a flat bed position. D. Decreasing room humidity. Answer B. Increasing oral fluid intake. This question focuses on non-pharmacological interventions for managing respiratory secretions, a common issue in respiratory care. The term most effective points to the primary nursing action for thick secretions. Adequate hydration is crucial because it helps thin respiratory secretions, making them easier to mobilize and expectorate. For example, encouraging a client to drink more water or administering intravenous fluids can significantly help loosen thick mucus in their airways. Always emphasize hydration as a simple yet powerful way to manage thick secretions. Question 19. A client is prescribed incentive spirometry postoperatively. The nurse should teach the client to use the device for which primary purpose? A. To measure lung capacity. B. To prevent aspiration pneumonia. C. To promote lung expansion and prevent atelectasis. D. To strengthen respiratory muscles. Answer: C. To promote lung expansion and prevent atelectasis. This question evaluates the nurse's understanding of incentive spirometry's purpose, a common postoperative respiratory intervention. The primary purpose focuses on its main benefit. Incentive spirometry helps clients take slow, deep breaths, which encourages full lung expansion, prevents alveolar collapse, atelectasis, and improves gas exchange after surgery or during periods of immobility. For example, a client recovering from abdominal surgery should use the incentive spirometer regularly to take deep breaths, helping to keep their lungs clear and expanded. Encourage clients to use incentive spirometry regularly to keep their lungs healthy and prevent complications. Question 20. The nurse is caring for a client with a tracheostomy who has developed respiratory distress. What is the immediate priority action? A. Suction the tracheostomy tube. B. Remove and replace the inner cannula. C. Assess the patency of the airway. D. Administer supplemental oxygen. Answer: C. Assess the patency of the airway. This question tests the nurse's ability to prioritize interventions during an acute respiratory emergency involving a tracheostomy, a high-risk scenario. The word immediate priority indicates the most crucial first step. When a tracheostomy client develops respiratory distress, the nurse's absolute priority is to ensure the airway is patent, open, as obstruction can be life-threatening. This might involve looking for dislodgement, mucus plugging, or kinking of the tube before attempting other interventions. For example, if a client with a tracheostomy suddenly becomes distressed, the nurse should first check if the tube is blocked or displaced. Always ensure a patent airway first in any respiratory emergency, especially with a tracheostomy. Question 21. A nurse is providing care for a client receiving continuous positive airway pressure, CPAP, via a face mask. The client reports skin irritation and redness on the bridge of the nose. Which nursing intervention is most appropriate? A. Apply a thick layer of moisturizer to the reddened area. B. Discontinue CPAP therapy for several hours. C. Loosen the mask strap slightly and apply a skin barrier dressing. D. Switch to a nasal cannula for oxygen delivery. Answer: C. Loosen the mask strap slightly and apply a skin barrier dressing. This question addresses a common complication of CPAP therapy and appropriate nursing interventions. The key is to manage the skin integrity issue while ensuring continued therapy. Skin irritation from CPAP masks is often due to excessive pressure or friction, therefore, slightly loosening the straps, without compromising the seal, and applying a protective barrier dressing, like Duoderm or a foam pad, can alleviate pressure and prevent further breakdown while allowing the client to continue therapy. For example, if a client complains of discomfort from their CPAP mask, adjusting the fit and protecting the skin is a practical solution. Always prioritize skin integrity while maintaining therapeutic effectiveness when caring for clients using devices like CPAP masks. Question 22. Which of the following is an early sign of hypoxemia in an adult client? A. Cyanosis. B. Bradycardia. C. Restlessness and anxiety. D. Bradypnea. Answer: C. Restlessness and anxiety. This question assesses the nurse's ability to recognize early signs of inadequate oxygenation, a fundamental assessment concept. The key is to identify the signs that appear before more severe or compensatory changes occur. Early signs of hypoxemia often manifest as neurological changes due to reduced oxygen supply to the brain, such as restlessness, anxiety, confusion, or agitation. For example, if a client who was previously calm becomes suddenly restless and anxious, the nurse should consider hypoxemia as a possible cause and check their oxygen saturation. Remember that changes in mental status are often the first indicators of worsening oxygenation. Question 23. A client with chronic bronchitis is being educated on self-management strategies. The nurse should emphasize the importance of which measure to prevent exacerbations? A. Limiting fluid intake to reduce mucus production. B. Avoiding all physical activity. C. Getting an annual influenza vaccination. D. Using cough suppressants regularly. Answer: C. Getting an annual influenza vaccination. This question tests the nurse's understanding of preventative measures for chronic respiratory conditions like chronic bronchitis. The keyword prevent exacerbations highlights the focus on proactive health maintenance. Respiratory infections, particularly influenza, are a major trigger for exacerbations in clients with chronic bronchitis, leading to increased symptoms and potential hospitalizations. Therefore, annual influenza vaccination is a crucial preventive measure. For example, advising a client with chronic bronchitis to receive their flu shot every year helps protect their already compromised respiratory system from common infections. Always stress the importance of vaccinations for clients with chronic respiratory diseases to minimize infection risk. Question 24. A client is scheduled for a thoracentesis. The nurse should position the client in which manner for the procedure? A. Supine with legs elevated. B. Sitting upright on the edge of the bed, leaning over an overbed table. C. Prone with arms extended overhead. D. Side lying on the affected side. Answer: B. Sitting upright on the edge of the bed, leaning over an overbed table. This question assesses the nurse's knowledge of proper positioning for a common respiratory procedure, thoracentesis, which is crucial for client safety and procedural success. For a thoracentesis, the client is typically positioned sitting upright, leaning forward over an overbed table with their arms supported. This position spreads the ribs apart, providing better access to the pleural space and maximizing comfort and lung expansion during the procedure. For example, you would help the client assume this position and ensure they are stable and comfortable before the physician begins the procedure. Remember that proper positioning is key for safe and effective procedures like thoracentesis. Question 25. The nurse is preparing to teach a client about the proper use of a metered dose inhaler, MDI, with a spacer. Which instruction is essential to include? A. Inhale rapidly and deeply after actuating the inhaler. B. Hold your breath for 1 to 2 seconds after inhaling. C. Exhale completely after actuating the inhaler. D. Rinse the spacer with hot water daily. Answer: A. Inhale rapidly and deeply after actuating the inhaler. This question focuses on correct technique for MDI use with a spacer, a vital component of client education for respiratory medications. When using an MDI with a spacer, the client should inhale slowly and deeply after actuating the inhaler into the spacer. This allows the medication to be delivered more effectively into the lungs, minimizing deposition in the mouth and throat. For example, instructing a client to breathe in slowly and steadily after pressing the inhaler button helps ensure they get the full dose into their airways. Emphasize the importance of slow, deep inhalation with a spacer to maximize medication delivery to the lungs.